Hello, my name is Cameron Brown, and I would like to welcome you to the mitigation of stress-related reactions during an incident. So when we look at self-esteem, then low self-esteem is a common denominator in the stress-prone personalities that we talked about. And of course, converse to that is the high self-esteem. It's a prerequisite for stress-resistant personalities because it is directly linked to the accessibility of one's internal resources. And there are 6 pillars of self-esteem, and that is a book, and it is written by Nathaniel Branden. First, we have the practice of living consciously, living in the present moment. And then the next pillar is the practice of self-acceptance, the practice of self-assertiveness, honoring one's wants, our needs, and our values. And then the next is the practice of self-responsibility. That is choosing to acknowledge responsibility for one's thoughts, feelings, and actually with the self-talk saying, I am responsible for my own happiness. And then the next is the practice of living purposefully. I don't think you would be helping with this disaster if you didn't have that purpose in life. Getting out of that thought process of hoping and wishing, and instead doing what you need to do to make your goals happen. And then the 6th pillar is the practice of personal integrity. And this is working to achieve the congruence between our values and our actions. And sometimes that can be challenging in itself. When we look at the individuals with low self-esteem, then they often feel powerless. They feel like they have very little control in their lives, and often are easily influenced by others. And sometimes we might think, can't they make their own decision? Don't they have a thought of their own? And they express a narrow range of emotions, can become easily defensive and easily frustrated. Maybe if they are challenged, or they have the fear that they are going to disappoint someone, or they're not living up to the expectations of others. And sometimes they even have a tendency to blame others for their own weaknesses. And when we think about those with a high self-esteem, they promote their own independence, and they assume given responsibilities. They approach new challenges with enthusiasm, like bring this on, I'm ready for it. And they can exhibit a broad range of emotions, unlike the low self-esteem, where they have a limited range of emotions. They're proud of their accomplishments, and they tolerate frustration. So what are some of the seeds for self-esteem? Well, these are planted early in childhood and comprise 4 basic elements: connectedness, uniqueness, power. Here we come back to this power, a sense that one can access inner resources, that we have these resources and these capabilities to influence circumstances in our lives. Models, those role models in our lives. Prior to a disaster, we should all try to raise our self-esteem. The high self-esteem increases our ability to cope with challenges when we're in the midst of a crisis. So how are we going to raise or maintain that self-esteem when we face crises? Number 1 is disarming that negative credit. We use negative self-talk, and I encourage you to challenge the voice inside that feeds the conscious mind with put-downs and those negative comments. A critic taking only one side is unbalanced and is very dangerous to our self-esteem. Give yourself positive reinforcement. You think about throughout the day, your peers, the people you are helping, how you constantly are reinforcing them in a very positive way. Well, remind yourself of your good qualities and write these down and look at the list when you're feeling down. Avoid the should-haves, where you place a guilt trip on yourself for unmet expectations. Learn from the past, but don't dwell on it. And focus on who you are, your own identity, your sense of calling to the nursing profession, and your role models or your mentors. Avoid comparison with others. Respect your own uniqueness and learn to cultivate that uniqueness. Avoid self-victimization. Martyrs may be admired, but begging for pity and sympathy gets old, and the effects are very short-lived. Improve your connectedness. Widen your network of friends and find special places in your environment that recharge your energy. We go into this disaster, we're able to cope, we have a high self-esteem, or we're somewhere in the middle. Then what are some other coping strategies that are going to help us cope? And these are not only for during a disaster, but I think that we can apply these on a daily basis. Coping strategies such as humor. Sometimes we take ourselves way too seriously. We need to lighten up and find one humorous thing about our day. There is always something positive or something humorous that we can extract. We can work to improve our imagination by reading, writing, playing, exploring, and creating something. Build a humor library. Keep a joke book with your deployment supplies. And then again, here it comes back to the self-esteem. Other coping strategies are self-care. We hear this all the time: work-life balance, self-care, and being able to reach out to others and avoid isolation. Attend the daily briefings and defusings. Again, knowledge is power. Letting go of unrealistic expectations of ourselves and others. Again, we just have limited resources, and that we have to learn to cope with that. Drink lots of water. I want to repeat this over and over again, because when we get dehydrated, we have a tendency to become very, very irritable. Exercise, walking, the plyometrics. Take a jump rope with you. Have that, and exercise bands in with your bag that you take on deployment. Communication skills. It is vital, and with our colleagues as well as our family. Our families are probably going to be very, very, very concerned about our safety and welfare. So being able to communicate with them whenever you have the opportunity. Also, with effective communication, it helps us to avoid miscommunication and to mitigate frustration and resentment. So being able to express our own thoughts and our feelings. Address issues by focusing on the problem, not the people. Coming back to the communicating with your family, let them know that you may go days with no phone service, but you're not avoiding them in any way, or you may just be so very busy, and when you finally get off your shift, then you're so exhausted you just want to take a nap. But mainly keeping your family updated about your safety, and be prepared for re-entry into home life after an extended period of time. Another coping strategy is the relaxation techniques, and we'll look at prayer and faith and meditation. These two processes share many similarities in that they both initiate a process of centering, increased concentration, and connectedness. Now shifting to meditation, and it's a practice of increased concentration, and it leads to increased awareness. It's a solitary practice or reflection on internal rather than external stimuli. And when you are in the midst of this disaster, you're probably going to be surrounded by many, many people. You're going to oftentimes just feel overly stimulated. Practicing the meditation can help to decrease your oxygen consumption. It decreases the blood lactate levels, increases our skin resistance, especially if you're having some breakdown. Also, decreased heart rate, decreases the blood pressure as well as muscle tension. Sometimes when we're under a great deal of stress, some people even look like that their shoulders are up under their ears. So being able to meditate, to focus on this, can actually help to lower the muscle tension. The increased alpha waves, that can help us with sleep, that the relaxation where we're still conscious, we're still aware, but everything is just that sense of ease. Our next that we're looking at is going to be practicing mindfulness. That's been in the moment, and it can dramatically alter how we experience the daily stress, pollutants of chaos, confusion, loss, anger, grief, and the fear that confront every human being. Some of the modern definitions about mindfulness is just opening to the moment, an open-hearted acceptance of where we are right now, that taking time to live in the what is as opposed to the what if, and also cultivating a neutral, detached awareness. Okay, now shifting to mental imagery, and it's using the imagination to observe in the first person images created by the unconscious mind. There are 3 categories: images that replicate peaceful scenes to promote relaxation. Mental imagery, they can substitute a less desirable behavior with a more healthy one. These images have been used to help damage body tissue as well as to help with pain relief. Taking it a little bit further with our visualization, that can be a directed exercise in mental imagery, consciously creating images of success, healing, or relaxation for the purpose of self-improvement. So how do we bring all of this together? What do we need to do? Practicing self-compassion, and spend at least 15 minutes daily in meditation, prayer, or quiet time. Also allocate at least 20 minutes a day of exercise within your capabilities. Practice laughter, coming back to this humor, finding something humorous in each day. Surround yourself with caring others. Get 20 minutes of sunshine every day, because now vitamin D deficiency is of epidemic proportion. Observe and truly experience nature, expressing that gratitude daily, even for the simple things that we often take for granted. Think positive thoughts whenever you can, and show compassion actively toward others. Eating a healthy diet, and try to eliminate junk food. Express your love and affection for your mate, for children, for friends, colleagues, and other family members. Give yourself permission to experience self-compassion and self-love. Practice that for yourself. Also, practice forgiveness. Sometimes it's easier for us to forgive others than it is ourselves. Be your own best friend. I invite you to take up this wondrous practice of self-care that empowers healing, health, joy, and well-being. We hope that you have found this presentation informational and feel prepared to keep your family safe while working during a disaster. Thank you so much for your time, and please visit www.texasnurses.org/C4C for more resources and information.